If you're on Medicare, you may have heard people talk about something called TrumpRx. Some people are claiming they're saving a lot of money on prescriptions. Others are saying it's a game changer. And some Medicare beneficiaries are wondering whether they should use it instead of their Medicare drug coverage. But there's one very important Medicare rule that most people do not understand. A lower prescription price today can sometimes cost you more money later. A lot more. In this video, I'm going to explain exactly what TrumpRx is, who can use it, the feature you should consider and think hard about. Every Medicare beneficiary should think hard about before using TrumpRx. I'm going to talk about when it can save you money and when it may actually work against you, and how to decide whether using it is the right move for your situation. So let's get started. First, what exactly is TrumpRx? Now, TrumpRx is not Medicare. It's not a Medicare Advantage plan. It's not a Medicare Part D drug plan. And it's not even health insurance. Instead, TrumpRx is a prescription discount program. The goal is to help consumers attain lower prices on prescription medications through participating pharmacies. In that respect, it works similarly to programs that many people have already heard of, such as the GoodRx or GlickRx or SingleCare or WellRx and other prescription discount card programs. But why was TrumpRx even created? TrumpRx was not created because the discount prescription programs didn't already exist or work. Programs like GoodRx and others have been available for years. The stated goal of TrumpRx was to create a government-backed portal that would help consumers compare drug prices, access manufacturer discounts, and benefit from the administration's effort to push prescription drug prices lower. Whether it ultimately provides lower prices than existing discount programs depends on the medication, the pharmacy, and the individual situation. And if you ask me, I'm not a fan of government competing with the private sector. That really should never be the role of the government. Anyway, when you use a prescription discount card, the pharmacy processes your prescription using the discount program instead of billing your insurance. And this is important. Sometimes the discounted cash price is lower than what you would pay through insurance, but sometimes it's higher, and sometimes it's pretty much the same. The important thing to understand is that a discount card and your insurance are usually two separate pricing systems. They don't work together. You can choose one or the other. And that raises an important question. So who can actually use TrumpRx? The answer is that it's generally available to almost everyone purchasing prescription medications, and that includes Medicare beneficiaries. It includes people enrolled in Medicare Advantage plans. It includes people with employer coverage and people without insurance at all. And it includes people who are paying cash for their medications. In many cases, you can simply compare the price available through the discount program against the price available through your insurance and choose whichever option works best for you. Now, that sounds simple enough, but this is where Medicare introduces a very important wrinkle. Actually, I think I would call it a pothole. It's more like a pothole than a wrinkle. If you're on Medicare, this next section is probably the most important part of the entire video. One of the biggest mistakes people can make is focusing only on the price they pay today. But Medicare beneficiaries also need to think about how today's purchase affects the rest of their calendar year. Here's why. Medicare Part D plans have a maximum out-of-pocket of $2,100 for the calendar year 2026. That maximum out-of-pocket only counts towards the prescriptions you purchase through your Part D plan. The same with your Part D deductible. If you purchase a prescription through a discount card rather than through your Part D plan, that purchase may not count towards your Medicare Part D out-of-pocket spending. With the recent redesign of Medicare Part D, all Medicare Part D beneficiaries now have significant protection once they reach an annual Part D out-of-pocket limit. That maximum out-of-pocket limit protects you from unmanageable financial harm in the years where your prescription costs are very high. Every dollar that counts within your Part D plan helps move you towards that protection. But if you purchase the drug outside of your Part D plan, Medicare will treat that purchase as if it never happened for purposes of your annual Part D spending limits. So let me give you a simple example. Suppose your Part D plan charges $50 for a prescription. Now suppose TrumpRx offers the same prescription for $20. Now, at first glance, using TrumpRx appears to save you $30, and it might. But if that $20 purchase does not count towards your Medicare Part D spending cap, Medicare may effectively treat that transaction as $0 towards your annual drug spending limits. That may not matter at all for someone who's taken one inexpensive generic medication and nothing more. But it could matter a great deal for someone taking expensive medications throughout the year, or someone who is diagnosed with a disease or condition that requires expensive medications later in the year. Your TrumpRx drugs do not count towards your maximum out-of-pocket limit or your Part D deductible. And understanding that difference is what separates a smart decision from a potentially expensive mistake. And by the way, if this is the kind of Medicare information that you're looking for, where we explain not just what something is, but how it can affect your health care and your wallet, make sure you subscribe to this channel and press the like button below. Now, we publish new Medicare educational videos every week, and our goal is to help you make informed decisions rather than costly ones. And let me know in the comments below if you consider using TrumpRx or would prefer a different discount plan or would never use a discount plan. I do read your comments, and thank you. Now let's talk about when using TrumpRx can actually be a very good idea. The first situation is when you're taking inexpensive generic medications that really don't add up to a meaningful sum of money. Many generic drugs have become so inexpensive that discount programs can sometimes beat Medicare copays. In some cases, the difference may only be a few dollars. In other cases, savings can be much more substantial. So if you take a low-cost generic medication and you're nowhere near the annual Part D out-of-pocket limit, using a discount card may make perfect sense. Another situation is when a person doesn't have Part D coverage at all. And some people have original Medicare but never enrolled in a Part D plan. Others may have gone without Part D drug coverage for various reasons. In those situations, a prescription discount program may provide meaningful savings compared to paying the full retail price. A third situation occurs when a medication is not covered by your plan. Sometimes the prescription falls outside of the plan's formulary, and sometimes prior authorization issues arise where there are other limitations. And sometimes those restrictions make coverage difficult. And so in those situations, a discount program may offer a lower cost alternative. And you have to look at that on a case-by-case basis. And there are also cases where someone needs a medication only temporarily, like an antibiotic. If a short-term prescription costs dramatically less through a discount card, the immediate savings may outweigh any concern about your Part D spending calculations. So yes, there are situations where the TrumpRx or any discount program can absolutely save money. But there are also situations where using it may not be the smartest choice. So let's talk about those. And the first involves people with high prescription drug expenses. If you take specialty medications, expensive brand name drugs, cancer medications, or other high-cost prescriptions, every dollar that counts inside your Part D plan can become very important. In those situations, your annual Medicare drug spending protections may be more valuable than a short-term discount. The second situation involves people who expect to reach Medicare's annual Part D out-of-pocket limit. If reaching that limit is realistic for you, purchases made outside your Part D plan may simply delay your progress towards those protections. In some cases, what appears to be a savings today could potentially cost more over the course of a year. Another mistake people make is assuming that the discount card price is automatically the lowest price available. That is not always true. Sometimes your Part D plan will be cheaper. Sometimes the pharmacy's cash price will be cheaper. Sometimes a different discount program will be cheaper. And sometimes the TrumpRx plan may be cheaper. The point is that assumptions can be expensive. It shouldn't be this complicated. It really shouldn't. But comparison shopping is often the smartest strategy. Now, there's another important factor many people overlook. Prescription prices can vary significantly between pharmacies. With that in mind, to help consumers shop between pharmacies, there are several states that have a fantastic online service that does that for you. For those states, you can find this service by searching for your state prescription price transparency program. In Florida, it's called the My Florida RX Prescription Drug Price Locator. And I'll have a link below, but in other states currently, they include Washington, Oregon, Virginia, Utah, New Mexico, and New York. And perhaps as this video ages, there may even be more. The exact same medications can have dramatically different prices depending on where you fill your prescription. I was getting on there and taking a look at different drugs and was amazed at how different it is from one pharmacy to the other. And that's why I always encourage people to compare before purchasing and never assume and always verify. Now let's talk about how to use TrumpRx correctly. The process is actually fairly straightforward. The website is TrumpRx.gov. Start by looking up the medication you need. Next, compare the available pharmacies and pricing options. And then compare the TrumpRx price against your Medicare Part D price or your Medicare Advantage prescription drug price. You may also want to compare the pharmacy's regular cash price. Once you have those numbers, ask yourself a very important question. Do I need this purchase to count towards my Medicare Part D spending? If the answer is no, and the discount price is substantially lower using the discount card, then your discount card might make sense. If the answer is yes, then the Medicare pricing may actually provide better overall value, even if today's price is slightly higher than the discount card. That's why I encourage people to think beyond today's choices. Think about your total annual drug costs. Think about your Medicare protections, and think about how this decision fits into your bigger picture. So what's the bottom line? TrumpRx is not insurance, it's not Medicare, and it's not automatically better than your Medicare drug coverage. It's simply another tool that may help some people lower prescription costs. For certain Medicare beneficiaries, it can provide meaningful savings. For others, especially those with higher prescription drug expenses, using it without understanding the Part D implications could be a big mistake. The smartest approach is to compare all of your available options and choose the one that provides the best overall value for your situation, not just the lowest price today, the best value over the entire year. Now, I'd like to hear from you. Have you checked the prices of one of your medications through TrumpRx? Was it lower than your Medicare plan? Leave a comment below and share your experience. And if you would like help reviewing your Medicare options, contact us at Medigap Seminars, where we provide personalized Medicare consultation with no cost to you. I'm Matthew Clausen with Medigap Seminars. Thanks for watching, and I'll see you in the next video.